This video offers help for treating molluscum contagiosum patients with YCANTH. Please watch it and read the full prescribing information, including the patient information section and important safety information. Hello, my name is Dr. Mercedes Gonzalez, and today I would like to discuss YCANTH, the first FDA-approved topical treatment for molluscum contagiosum in adult and pediatric patients 2 years of age and older. YCANTH is physician administered, and all healthcare professionals should receive instruction and training prior to preparation and administration of YCANTH. First, I will discuss the YCANTH components, and then I will review the instructions for use and best practices. YCANTH is a proprietary drug-device combination product that contains a Good Manufacturing Practices or GMP-controlled formulation of cantharidin, 0.7%. YCANTH is delivered via a single-use applicator that allows for precise topical dosing and targeted administration to affected skin. YCANTH contains a plastic tube containing the drug in a sealed glass ampule and an applicator tip with a filter. The formulation contains an oral deterrent, denatonium benzoate, to help mitigate the risk of accidental ingestion. It also has a violet coloring that is intended to aid in the visualization of the drug product on the treated skin. You can find a complete list of ingredients in the YCANTH full prescribing information. Step 1. Begin by putting on gloves and eye protection. Step 2. Remove the YCANTH applicator from the outer protective tube. Pull the ring to remove the purple end cap out of the white outer protective tube. Slide the YCANTH applicator out of the outer protective tube. Do not remove the applicator cap. Step 3. Remove the paperboard sleeve. Completely remove the white paperboard sleeve so that the glass ampule is visible. Do not remove the applicator cap prior to breaking the glass ampule. Step 4. Inspect the YCANTH applicator for damage. If any damage is observed, dispose of the YCANTH applicators in a sharps container and handle in accordance with accepted medical practice and applicable law. Step 5. Break the ampule using the YCANTH brake tool. Set the YCANTH brake tool on a horizontal surface. Ensure the applicator cap is in place. Place the YCANTH applicator in the YCANTH brake tool with the cap pointing toward the hinge. Press down firmly on the YCANTH brake tool until a snap is heard. Open the YCANTH brake tool and remove the YCANTH applicator. If any leaks are observed, applicators should be discarded in a sharps container and handled in accordance with accepted medical practice and applicable law. So again, make sure the brake tool is set on a flat surface, and you can see the applicator easily drops into the brake tool on an angle. It will be positioned properly for the glass ampule to be activated by the plastic pins. Do not repeat this process, only close the brake tool once. Step 6. Tap YCANTH applicator to move YCANTH solution. Gently tap the capped end of the YCANTH applicator on a horizontal surface for approximately 10 seconds or until the YCANTH solution has collected at the bottom of the applicator tube. The purpose of this step is to move the YCANTH solution towards the tip of the applicator. Gravity may allow all the solution to move towards the bottom of the applicator tube. Gentle tapping is needed only if the YCANTH solution does not move towards the tip of the applicator. Do not squeeze or apply pressure to the applicator during this step. Squeezing the applicator here can cause too much YCANTH solution to flow prematurely into the tip and potentially cause too much YCANTH solution to flow out of the applicator. The intent is to not push the solution through the filter during this step. Step 7. Test the YCANTH applicator. Remove the applicator cap. Gently squeeze the applicator to apply a droplet onto a paper towel or gauze to confirm the YCANTH applicator is working properly. Testing the applicator helps to establish the flow of YCANTH solution before applying YCANTH to the patient. This step enables you to control the amount of solution applied. Remember, YCANTH is a slightly viscous film-forming solution, It is intended to be applied as a thin film onto molluscum lesions, which are generally very small. So it is important to not squeeze the applicator too hard, or too much solution may be expelled. To squeeze the applicator, apply gentle pressure. The applicator should be held gently as you would grasp a pen towards the center of the applicator. You can set the amount of solution and flow based on finger pressure and angle of the applicator. It is important to get the flow right when testing on gauze before the solution is applied to a lesion. Never squeeze at or near the tip of the applicator. Never clutch the tube in your fist. If there is no flow from the tip, tilt the tip up in order to let any glass that has accumulated towards the tip to move back and unclog that area. Step 8. Apply a small droplet of the YCANTH solution onto a molluscum lesion. Use the applicator tip to spread the solution to cover the entire lesion. Repeat the application until all lesions have been treated. If YCANTH solution contacts any unintended surface, including healthy skin, immediately remove the excess solution by wiping with a cotton swab or gauze. Do not attempt to use a clogged YCANTH applicator. To be clear, a small droplet means a small, tiny drop. Only a thin film of YCANTH is needed to cover the bumps. The applicator has a small opening to help target the lesions with the solution and help keep YCANTH off healthy, unaffected skin. Make sure to invert the applicator in between lesions to avoid YCANTH from getting on unaffected skin. If the drug flow stops or is slowed, repeat tilting the tip up to clear the area. Step 9. Allow the YCANTH solution to completely dry, up to 5 minutes, before contacting healthy skin to avoid transference. Do not cover any treated lesions with bandages. It is important for the YCANTH solution to dry before dismissing patients. Again, this can take up to 5 minutes. Dismissing a patient before YCANTH is dry could cause the YCANTH solution to spread to unaffected healthy skin, especially in intertriginous areas like the axillae. Step 10. Applicators should be discarded in a sharps container and handled in accordance with accepted medical practice and applicable law. Do not reuse the YCANTH applicator. YCANTH brake tool maintenance. For proper maintenance of the brake tool, wipe the surfaces of the YCANTH brake tool with 70% isopropyl alcohol following each use. Inspect the YCANTH brake tool for damage. For example, look for cracks in plastic, missing or broken braking posts, and check the function of the hinge prior to each use. After 12 uses, or if any damage is observed, the YCANTH brake tool should be managed as solid waste and placed in plastic recycling containers or the general trash.
Indication: YCANTH cantharidin topical solution 0.7% is indicated for the topical treatment of molluscum contagiosum in adult and pediatric patients 2 years of age and older. Important safety information. Contraindications: none. Warnings and precautions. YCANTH is for topical use only. YCANTH is not for oral, mucosal, or ophthalmic use. Life-threatening or fatal toxicities can occur if YCANTH is administered orally. Avoid contact with the treatment area, including oral contact after treatment. Ocular toxicity can occur if YCANTH comes in contact with eyes. If YCANTH gets in eyes, flush eyes with water for at least 15 minutes. Local skin reactions. Reactions at the application site may occur, including vesiculation, pruritus, pain, discoloration, and erythema. Avoid application near eyes and mucosal tissue, and to healthy skin. If YCANTH contacts any unintended surface or healthy skin, immediately remove. If severe local skin reactions occur, remove prior to the recommended 24 hours after treatment. YCANTH is flammable, even after drying. Avoid fire, flame, or smoking near lesions during treatment and after application until removed. Adverse reactions. The most common, incidence greater than or equal to 1% reactions, are the following local skin reactions at the application site: vesiculation, pain, pruritus, scabbing, erythema, discoloration, application site dryness, edema, and erosion. Local skin reactions at the application site were observed in 97% of subjects treated with YCANTH during clinical trials. These local skin reactions are expected and related to the anticipated blistering response of the skin to cantharidin. Drug interactions. No studies evaluating the drug interaction potential of cantharidin have been conducted. Use in specific populations. Pregnancy. There are no available data with use of YCANTH in pregnant women to evaluate for a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Given that systemic exposure to cantharidin following topical administration is low, maternal use is not expected to result in fetal exposure to the drug. Lactation. Avoid application of YCANTH topical solution to areas with increased risk for potential ingestion by or ocular exposure to the breastfeeding child. Overdosage. Oral ingestion of cantharidin has resulted in renal failure, blistering, and severe damage to the gastrointestinal tract, coagulopathy, seizures, and flaccid paralysis. Please see accompanying full prescribing information. To report suspected adverse reactions, contact Verrica Pharmaceuticals, Inc. at 1-877-VERRICA. That's 1-877-837-7422. Or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Local skin reactions are expected and should be reported if they are severe.